Now recommending the development of a new COVID-19 booster shot specifically targeting the Omicron variant. Western Mass News reporter Reagan Locree joins us live in studio after getting answers on what makes this booster different than the rest.
Mary, I spoke with the president and CEO of Baystate Health today. Back in April, he told us he wasn't recommending a second booster dose and he wasn't planning to get one. But his position has changed when it comes to a new version of the vaccine.
When this Omicron booster does come out, I'm definitely going to be out there getting it for myself.
Western Mass News checking in with Dr. Mark Kerouac, president and CEO of Baystate Health, after the Food and Drug Administration Advisory Committee voted this week to recommend a reformulated COVID-19 booster shot targeting the Omicron variant as early as this fall.
The more and more we have precise vaccines that really work against the current virus that's going around, the more the disease will just be mild or trivial or really maybe asymptomatic, no symptoms at all.
Dr. Kerouac points out the current vaccines are based on the virus that emerged in late 2019.
It's kind of like a key into a lock. The key might partly work or it might work sort of okay, but there's nothing like designing something against the actual target that's out there.
He says altering the COVID booster shot is similar to updated flu shots every year.
The flu comes around in different strains, and what worked against last year's flu doesn't necessarily work against this year's flu. The coronavirus, or COVID-19, is an RNA virus that is distantly related to the flu, and so it does continue to change in terms of the way it looks to our immune system. And the antibodies that we might have had against the original COVID viruses are really not going to work as well against the new variant.
Dr. Kerouac agreeing with the FDA, who recently called 2020 a transition year, saying we could soon change how we view COVID-19.
Sort of the ongoing quieting down of the COVID-19 pandemic. In other words, right now, cases are less and less serious at Baystate. We've got about 60 or so patients in the hospital, but over half of them have almost no symptoms. And it's because most people have gotten vaccinated, and many of the people who aren't vaccinated have already gotten the infection.
Pfizer is currently working on an updated booster shot, which the company says is showing a high immune response against the Omicron variant. The FDA is currently asking all vaccine makers to start clinical trials for updated boosters. Reporting live in studio, Reagan Locree for Western Mass News.